Welcome, everyone. I'm Dr. Ashraf Amir. I'm a consultant in family medicine, International Medical Center. I'm very delighted to have with us here today our guest, Dr. Saeed Alamoodi, who's a consultant in family medicine in IMC. And today we are going to explore a very important part of migraine. Why is migraine still underdiagnosed in primary care? Dr. Saeed, why is migraine still underdiagnosed in primary care? Can you tell us?
Well, migraine diagnosis is usually straightforward and based mainly on clinical history using the ICHD3 criteria. However, many patients don't describe their symptoms clearly. In Saudi Arabia, patients often call migraine like sinus headache, stress, or simply a bad headache. Other patients normalize symptoms because migraine runs in the family or because of cultural beliefs that headaches are not serious enough to seek the medical care. Also, another challenge is that migraine doesn't always present as the classic one-sided throbbing headache. Some patients mainly complain of neck pain, fatigue, dizziness, or light and sound sensitivity. These atypical symptoms can confuse diagnosis.
Dr. Said, do culture factors affect migraine diagnosis in Saudi Arabia?
Absolutely. Many patients may feel their pain is just part of life, especially women, balancing between work and family responsibilities. There is also a stigma around the invisible illnesses like migraine. Patients may feel others think they are exaggerating symptoms. That's why physicians must create a comfortable environment where patients feel heard and understood.
Okay, so what is your practical approach when a patient complains of frequent headache, Dr. Said?
I begin with focused history and then use the ID migraine screening. It composed of 3 simple questions. The first question is, does light bother you during the headache? Do headaches limit your activities? Do you feel nauseated during the attacks? If the patient answers yes to at least 2 questions, migraine is highly likely. It is very fast, effective, and I think it's very useful in our busy primary care clinics.
Okay, so Dr. Said, what additional questions help confirm migraine?
I ask whether the pain is throbbing, whether physical activity worsens the pain, whether there is sensitivity to the sound. I also ask about the headache frequency because this helps to determine whether the patient has episodic or chronic migraine. Family history is also very important because migraine often has a genetic component. Finally, in Saudi Arabia, I also ask about the common triggers such as sleep deprivation, stress, fasting, dehydration, heat exposure, also excess caffeine intake. These are very common migraine triggers locally.
Okay, so how do you ask about aura symptoms? Can you tell us a little bit about it?
Yeah, patients rarely use the word aura. Instead, they may describe blurry vision, flashing lights, numbness, tingling, or dizziness. I avoid medical terminology and I prefer to ask simple questions like, do you notice visual changes before the headache? Do you ever experience tingling or speech difficulty? Aura symptoms usually last less than 1 hour and often occur before headache pain begins. Persistent symptoms should raise concerns for stroke or TIA, and I may require urgent referral in these cases.
Okay, Dr. Said, what headache red flags should primary care physician never ignore?
Yeah, of course. I use snow mnemonic, which is important for the warning signs, and include a sudden thunderclap headache. If there is systemic symptoms like fever or weight loss, a neurological deficit, a progressive worsening headache, headache triggered by coughing or posture changes, papilledema, pregnancy-related headache, or if the patient describes a new headaches after the age of 50. If any of these are present, the patient needs urgent investigations or referral.
How do anxiety and depression complicate migraine diagnosis?
Patients with anxiety or depression may focus more on fatigue, stress, or sleep problems and fail to mention disabling headache. Chronic migraine can also resemble tension headache or medication overuse headache. That's why physicians need to actively explore migraine symptoms instead of waiting for the patient to communicate them.
Dr. Said, what do you do when the diagnosis is not clear? So, what is your action?
I think this is a very important question. I don't rush to the diagnosis usually. I ask patient to use a headache diary to track frequency, duration, triggers, associated symptoms, medication use. Over time, patterns become clearer. Some patients prefer mobile apps, while others prefer the paper diaries. Both can be very helpful.
When should primary care physician refer migraine to the specialist?
Referral is important when there is red flags suggest a secondary headache, diagnosis remains unclear after repeated visits, or if the patient has chronic migraine and not respond well to the treatment, and of course if the patient remains highly anxious about a serious disease. But in most cases, migraine can and should be managed confidently in primary care.
Okay, Dr. Saeed, thank you so much for today's discussion, highlighting that migraine diagnosis doesn't need to be complicated. By listening carefully, asking structured questions, recognizing red flags, and following patients over time, physicians across Saudi Arabia can improve migraine care significantly, inshallah.